Error. Electricity in line. Override accepted. Infusion initiated.
Welcome to the INS Infusion Room, the official podcast of the Infusion Nurses Society. In this podcast, we explore all things infusion therapy through a real-life conversation, covering the latest trends, new research, evolving standards, and key industry insights. Whether you're an experienced infusion nurse or new to the field, we aim to keep you informed and empowered with the knowledge to stay at the forefront of the profession. My name's Derek, and I'm your host. Let's dive in. Hello and welcome to another episode of the INS Infusion Room. Today we have a very special guest. As you can see, we have Dr. Steinheiser in the house. Welcome, Dr. Steinheiser, and she's our Chief Clinical Officer here at INS, and she leads everything clinical. Welcome.
Thanks, Derek. Thanks for having me. I've been an infusion nurse since 1990 and been certified with INS since 1991. So I've basically grown up literally with INS at the cornerstone of my career. And I now work for INS. I started in 2017 as the Director of Clinical Education. And as you mentioned, now I'm the Chief Clinical Officer. So I'm excited to tell our audience more about what we've been doing over the last year.
Absolutely. And along the way, Dr. Steinheiser has led many initiatives within INS, publications, special projects, expansion of current departments. So it's truly an honor to work with you, Marlene. So thank you so much for all your contributions within not only the sciences, but within the infusion specialty. So today we're going to be talking everything podcast, everything INS, and really recapping what this past season entailed for the INS Infusion Room. Maybe give a little glimpse as to what's in the future for season 2. So today signifies a very special moment. It is our last episode for season 1 of the INS Infusion Room. Wow, what a quick year it has been. Would you agree, Marlene?
Exactly. I know. Countdown to 2026. Here we come. Yeah, it's been a really, impactful year, I think, Derek. And you've joined me in a lot of our initiatives. And I think one that's really important is just talking to not only our infusion clinicians that are part of our specialty, but really growing awareness of IV therapy, infusion therapy, and vascular access to with professionals outside of INS. And so we've been collaborating with so many organizations. So I don't want to exclude any that I might not get to mention today, but some that we've been working with prominently. The NICA is the National Infusion Center Association, and with NICA, we've been presenting at their annual meeting. And this year, I say last year because it's their last year conference, but this year we actually also not only did Derek and I present a general session, but we also participated in a workshop, the pre-conference workshop. So that was really exciting. And then also we work with the National Home Infusion Association as well. We also have had 2 initiatives with APEC, which is our infection prevention colleagues. We worked on the safe injection practices guidance documents, so we were reviewers for that. And then our team also worked extensively on the CAPC implementation or prevention implementation guide. And that was collaboration with Dr. Victor Rosenthal, Barb Nickel, and Dr. Tricia Clyden and myself. And so we were able to work with them on that initiative, and that has been published as well. So we've been very busy also with the Emergency Nurse Association. Our emergency nursing colleagues, they place peripheral IVs all the time, right? So we've been able to work with them, but particularly on the intraosseous position paper. So we were able to get that published this year with collaboration of ENA. So let's see, what else have we been working on? We've been working with our international affiliates, with INS Poland. Our INS Poland president, Dr. Maciej Latos, was with us at our INS conference this year. And
he was a guest this year in the podcast.
Yeah, and he was, that's right, he was a guest in the podcast. And we'll be going to Poland to present at their conference next year. So that's pretty exciting.
Super exciting.
Yeah. And then INS Argentina. INS Argentina asks INS every year to present at their conference, and we do that virtually. This year, the topic was on clinical competency, so we were able to present that topic at their conference.
And another special collaboration we had this past year was the RU offerings that we had with Ava. Can you talk about that a little bit?
hmm Yeah, so of course, our vascular access is very important. We can't infuse anything without vascular access devices. So we've been able to partner with AVA on that initiative. And also reaching out to our med surg nurses. We made contact with the American Society for Med Surg Nursing. Our standard of practice chair, Barb Nickel, presented at their annual conference, and they'll be on our podcast next year. And we'll be working with
Not
them.
giving away too much though, right?
Not,
But
yeah,
something to look forward to in
yeah.
season 2.
Something to look forward to, yes. So, really, a lot of our initiatives this year has been not only to educate those within our specialty, but those that are working with patients that receive infusion therapy outside of our specialty, because we know that that's an important initiative.
So in
Yeah.
25, we were in Vegas for our annual meeting,
Mhm.
and we had some special things that we offered this year
Mhm.
at our annual meeting. Let's talk about some of those highlights.
Yeah. Well, of course, the pre-conference hands-on workshops, those were very well received. We had two pre-conference workshops, so we look forward to next year as well. um, Been a highlight over the last couple of years. And this has only been, I want to say, 2 years working on three that we've presented quality improvement projects. And this has been a really nice way for those that have maybe not presented before, maybe are new to looking at quality improvement, but are able to work with their teams at their organizations to collect data and then present at INS. So we do a call for those presentations every year, and those have been really nicely received. And, some of those presenters have gone on to do more with their quality improvement projects and are now podium presenters for us. So that's really exciting.
That has been very exciting. And, I love the fact that many of these QI projects really stem from the science and the work that's being completed
Mhm,
within INS, whether it be the infusion therapy standards of practice, additional
mhm,
articles that are being published through the GEN, but the evidence that's being produced and provided by INS, seeing that come into play at the bedside and really evaluating how those interventions are truly affecting patient care. So it's
mhm,
been so enlightening to see individuals
mhm.
work within that capacity and further add to the scholarship within our industry.
And our reach has been growing, and we're in, I don't know if the audience knows, but INS has members in 42 countries. And so we've had many of those members come to present at our annual conferences or annual meetings, as well as engaging in webinars and podcasting with you, Derek. And so our outreach is really expanding. I think only last year we had 40 countries, so we expanded to two more, and that continues to grow.
So let's shift to social media world. So we also
Mm,
did a lot of things in social media world, including, the podcast, but also some
mm.
other initiatives to really reach additional individuals, not only within our specialty, but nurses in general. What has been your favorites to see?
Well, I will say I've been really enjoying your podcast, and I don't know if the audience is aware, but this was a relaunch in 2025, and so this was your program to host, and so you've done an excellent job with hosting. And I know that listening to some of the podcasts, it's hard to like even pick my favorite, but I think one of my favorite moments was when I was looking at social media, and it was the tip of the week, I believe, and it was talking about peripheral IV catheter site placement and optimal placement, not being in the antecubital fossa or any area of flexion.
Yes.
And we
Yes.
had an emergency room nurse comment and say, "I want to download this and create a poster of this in my emergency room." And I
And we
thought,
welcome that, by the
"Yay."
way.
I thought, "Yay." I mean, there's been so many times, I know those that know me know that my family members, have been in and out of emergency rooms, over the last year a couple times, and I've tried to advocate when it wasn't necessary for that peripheral IV catheter to be placed in the antecubital fossa, and I've not been successful. So, I was really excited when I saw that that nurse posted that. So
So what changes or developments within INS education department this year do you feel has been the greatest impact on infusion nurses and clinical practice?
Well, I would have to say one of the biggest improvements, and actually we continue to grow in this department, is working with our National Council on Education, and we call them NCOE for short. And that committee has grown to 10 members. We have, such wonderful committee members that have really worked to increase the quality of our programming. They actually work with us to evaluate the submissions that we get for the call for abstracts, and then they also work with us as we're developing the speakers and the actual PowerPoint presentations so that they're engaging. So not only are they engaging, but they're scientifically based. And so that's really increased the rigor and quality of our education. So I'm really, really proud of our team.
I definitely mirror those sentiments. So there's been a lot of initiatives in 2025 within INS.
Mhm.
What do you feel has been the most meaningful or exciting initiatives that
Mhm.
INS had to offer in 2025 as we look back?
Well, when I look back, I look at what we're doing with the Standards of Practice Committee, and the Standards of Practice are they're the cornerstone of INS. And this committee has been working diligently on the 2027 publication. And we have a new editor in chief, Dr. Victor Rosenthal, and Barb Nickel is our chair, and our vice chair is Dr. Tricia Clyden. And they're leading the team, and they're doing incredible work. There is so much literature. I mean, the literature continues to grow. And they're at this phase right now as we end 2025 and drafting those initial standard statements. And so next year, we'll be looking at the public comment review period. And before we know it, we'll be looking at publication because it comes really quickly. So we're really
It
excited for
happened
that.
it happened so quick.
And also, we have a new editor in chief for the Journal of Infusion Nursing. It's Dr. Susan Lown. And Dr. Susan Lown was an NCOE member with me a few years ago, and she has now grown into the position of the editor in chief. And so that's really exciting. And she actually just earned her CRNI. So another
Wonderful.
exciting piece of news. So we have another CRNI on our team. So that's great.
And we welcome both Victor and Susan to the team. We're so excited to have you if you're listening.
Yeah.
So, what organizational changes or strategic direction do you want members to know as we head into the new year?
Well, there's so many things that are important when it comes to providing infusion therapy care for patients. There's a few that are really top of mind right now, and many of those in the audience are probably going to shake their heads and nod and say, yes, we agree. Hospital onset bacteremia is one. There's been a lot of focus over the last year about what is it, what does it entail, how are we going to mitigate risk for patients with hospital onset bacteremia, particularly related to infusion therapy and vascular access. And so you'll see more to come on that topic, and there's more initiatives that we'll be working on with that. Also, vascular access site selection. And we were just joking about placing peripheral IVs in the antecubital fossa, but also, really about peripheral IV catheter insertion, correct, not only site, but the correct training and competency for the clinicians that are placing. So there's been a lot more focus on peripheral IV catheter, short peripheral catheter insertions. Um, and really highlighting that it's not just a peripheral. And you'll see that there's some education that will come next year at our annual meeting surrounding peripheral IV catheters. I remember in the early 90s when I attended INS, I would sit in those rooms and picks pick placements were kind of new for me at the time because I was a new CRNI and new into infusion therapy. And I remember sitting in in the conferences and listening. All the sessions, a lot of them were about picks, and now we're switching to a lot of information and a lot of training about peripheral IV catheters. because we know they're not just a peripheral, they're very important. So I think those are, also vascular access device management as well. And what we're learning is that not only outside of the country where there's differences in how care is provided, and we're providing education around aspects such as using pre-filled saline syringes rather than drawing our saline syringe from a mini bag or from a vial. And not only the workflow issues, but also infection prevention and safety issues surrounding using pre-filled syringes. So there's education not only outside the U.S., but within the U.S. around that topic. I, was a little surprised that, we do need still to provide some of that education, that not everyone is aware of that. So it's really sounds like a very simple topic to cover, but extremely important for our patients so that we don't cause infection. Okay, so I'd like to flip the script a little, Derek.
Uh-oh.
Since the podcasts have been your domain for this year, I'd like to hear from you a bit about what challenges and favorite maybe aspects of the podcast that you've encountered over the last year.
Yeah, thanks for that question. And I tell you what, to answer that question, it's really hard for me to really narrow down my favorites. This whole journey has been so new and exciting to me. I often joke that moving into this role and project of relaunching the podcast, I'm a nurse with a mic, okay? And so I've learned so much over the year, and I've had great opportunities to engage with experts from around the world. It has been so amazing. But what I can do is provide you two of our most viewed episodes, clips from our two episodes we can talk about. So the first one, and if you're already here, we have the episode with Andrew Walker that's had officially the most amount of views and the most amount of downloads this season. So here's a clip from Andrew's episode. I think that there's a misconception within how people interpret the standards when we talk escalation of care. A lot of people read the standards in regards to the 2-attempt rule, and they think that they have to try 2 times before they escalate care to a more advanced clinician or additional tools. But that's not what the standard's intent was. What it was saying is no more than 2 attempts.
Before I got a hold of our policies, that was clearly written that nurses are required to try twice before calling for help on it. And I changed that. I removed that because I was aware of that standard. And some of our older nurses really like to make a valid attempt if they can see a vessel and if they can palpate a vessel. And a lot of these, the newer nurses that we're getting out of the last 5-6 years, they're not going to go to try to do something if they don't feel like they can get it the first time.
And I think he carried a really important message that I know that you share the same thoughts.
Yes. Yes. If you can't visualize or palpate the vessel, you should not be attempting. Yes. And there's so many, he's right. There's so many different organizations that have this written into their policies. I actually just reviewed a learning module that had that in the learning module. And I want to say, no, we don't want to do that.
And there were so many other key concepts within that episode that I think made it special. The main discussion was about ultrasound utilization. How do we train and maintain competencies, not only for vascular access nurses or specialists, but nurses at the bedside? So he led an important project within his organization on doing training across the entire organization for nurses that were selected to participate in the special training to expand their skill set. And he's had a lot of success within that. And I also want to make mention that Andrew is part of the INS board, newly elected into the secretary position. So not only thank you for joining the podcast, but thank you for your works with the INS board as well. Our second most viewed and downloaded episode was the important discussion around IV iron with Dr. Van Doren. So I'm going to play a little clip from our highlight reel, and then we can talk a little bit about that episode.
But I will back up and start by saying that iron is important for many processes in the body, not just red blood cell formation and red blood cell health. It's important for cognitive function. It's important for muscle function. And remember, the heart is a muscle as well, right? It's important for those who are pregnant, for brain development of the fetus. So iron is involved in many processes in the body. And if we lack that, then that's where we can run into potential problems. But it's not recognized because oftentimes, unless somebody is anemic, which is really kind of like the very severe form of iron deficiency, then iron is not checked. So iron deficiency anemia is anemia, right? And then anemia due to iron deficiency. And then iron deficiency without anemia is in the name. You're not anemic, but you're still iron deficient, which can cause a lot of problems.
Yes, Dr.
Yes.
Van Doren's a wonderful educator too. I have to put a plug in for her, working with her. She just relates so well to providing that medical information as an MD and then relating that to infusion therapy nursing practice, which I truly appreciate. And, I was fortunate enough to work with her on a consensus paper that we published. I want to say it was a little bit over a year ago. So she's a wonderful educator.
She's absolutely brilliant, and working with her through the IV Iron series was just truly remarkable to see
Mhm.
all that she knows within that realm and her specialty. So thank you, Dr.
Mhm.
Van Doren, for joining the podcast this year.
So, Derek, I'm sure you've had some fun, maybe unexpected twists with your podcast. So maybe you can share the highlights of those fun episodes that you encountered in 2025.
Of course, with every episode comes its own bloopers or funny
Mm.
moments. We've had many bloopers that we've had to edit out. As we are recorded, we're not live, so we have the opportunity to make corrections to what we say. So lots of those. I'll save the time and not play all of our bloopers. But what I will do is I have a couple of segments I would like to share from some funny times that we've had in 2025.
On time without being visibly sweaty and panting from the challenge of just running upstairs, downstairs, across the hall to get to the session on time. Of course, all the NCRE members are passing each other, just head down, just trying.
Tell them a little bit about what we do at the conference. So what's your response? So you help your speakers get prepared to present. And
Yes.
then at conference, talk a little bit about what you do and why you don't run in heels.
Yeah, I know. I apologize to those speakers I was panting in front of last year.
I can relate to that because I sometimes when we get to the annual meeting, I feel like I need to be like one of the Disney characters or Mickey Mouse or Minnie Mouse, where they have the chaperones that kind of get them from room to room so they can kind of get where they need to be really quickly.
I just loved her depiction of what that was like because that was so raw and real.
Yeah.
And thank you so much, Corey, for all the work that you do with NCOE. As you may, some of you may or may not know, Corey is our chair for the National Council on Education. So, in her episode, we broke down the behind the scenes of the NCOE and developing the annual meeting. So thanks, Corey, for all your work. And hopefully this next year you will not wear heels so you can be quicker in between sessions.
I wouldn't count on that, but maybe she's gotten more skilled at walking quickly. She likes her heels.
Yeah. Another funny moment we had was with our INS president, Jennifer Stovall. Here it is.
Our former presidents, they walked in heels, the heels of respect. They walked, they were respectful, they were professional, they were just gracious, very graceful. But now we've got to catch up in that we got to catch up with technology, with healthcare, where we're going. So we're going to be wearing our Nike Dunks. We're going to, too bad you can't see them, but
can we no, okay.
Yeah, come on.
Okay, just do it. Yeah, let's do it.
With you. Okay, if I can't get my leg down, you're gonna have to help me.
Albert.
There we go.
Look at these. And by the way, this is a different pair from yesterday. Oh, Jennifer.
Maybe we can get Corey a pair of those.
I think that's what she needs.
Mhm.
But that was truly a unique moment First of all, Jennifer, kudos for being able to raise your leg that far. And second of all, I love the message behind it.
What do you think was the most impactful or impactful episodes, if you have to pick more than one?
Well, I knew you were going to ask me this, and I was a little nervous because I feel like they've all been impactful. Don't get
Mhm,
me wrong. We've really highlighted many
mhm,
different initiatives, projects, and work that's being completed by experts from around the world this
mhm,
year. But so instead of what I felt was the most impactful, I wanted to bring highlight to something that's meaningful to me and be
uh-huh,
biased. But
mhm,
um, the episode this year that was really true and dear to my heart was the episode with Katie Morgan and Alicia Barron. And here it is.
Yeah, I think a lot of times, doing what's best for the patient feels like it should mean, and often does, doing what the patient wants, right? But there are times when doing what the patient wants is going to bump up against doing harm to the patient, right? It's a really tricky spot, and I can totally see why you chose to define those terms right out of the gate because they conflict in a lot of situations.
They 100% do conflict, and it creates that gray boundary, and it puts the clinician at the forefront, on the front stage to make those decisions within those plans of care. I mean, often that clinician is the nurse. And there are additional resources like ethic committees and some additional resources that nurses can rely on, but oftentimes nurses are having to make these decisions pretty quickly, depending on certain
mhm,
scenarios. And to give a little bit of backstory, if
mhm,
you didn't watch that episode, I recommend hopping over. Actually, watch the whole season. But looking at that episode, we were evaluating patient autonomy versus nursing judgment. And there's
mhm,
that gray line, and
mhm,
I think we can all, as nurses and clinicians as a whole,
mhm,
can come up with a story as to a time where we had to make a decision quickly based upon our moral compass, but also preserving the rights and dignity of our patient. So that was a very impactful discussion. So that's why I chose that one to highlight today.
mhm. Well, speaking of impact, the podcast, now that we've relaunched, is been viewed in 20 countries. Is that correct?
20 countries.
20
I
countries.
was excited that first month when we looked at the end of the month report and we
Mhm.
had 3 countries.
Yeah. Yeah.
And we were excited to show the map. We lit up in 3 countries the first month, right?
Yeah.
And
Yeah.
then throughout the year, we just saw the number increase within different countries. By the way, countries that we are not necessarily directly affiliated with or have a partner program, these
Mhm,
countries are watching the podcast. So it's doing exactly what we wanted to do is reaching
mhm,
out and engaging clinicians around the world to
mhm,
provide um, important discussions.
mhm. Yeah, that's amazing, and that's INS's mission, and we're actually seeing it happen. So it's really exciting to see that the podcast is reaching so many clinicians around the world. Okay, so 2026 is around the corner, and in January every year on the 25th, we celebrate IV Nurse Day. But this year, coming up in 2026, we're celebrating IV nurses all week, and we have some special education programming. And Derek, maybe you can fill in with our audience what is going on that week.
Yes. So lots of work that's being done into not only season 2 of the podcast, it's going to be included within IV Nurses Week, but within the webinars as well. So we are providing a special celebration for IV Nurses Day, but it's a week-long celebration to where each day we are offering free, yes, free education to clinicians globally. So this enables all clinicians to join in and get infusion therapy education completely 100% free. Thank you to our sponsors who are enabling this opportunity. It's going to be a special celebration to where we're highlighting various aspects within the infusion therapy world. So be sure to tune in, start off season 2 with the first episode on that Monday, January 26th. And we'll have 2 additional podcast episodes releasing that week, in addition to 3 webinars. So be sure to Mark your calendars because you won't want to miss this very important celebration.
Thanks, Derek. Yes, it's a great way for us to show appreciation to our infusion therapy clinicians. And I love the theme that we have this year. It's igniting health and inspiring hope. And so I really, really love that theme.
I agree. I'm looking forward to it. All right. So as we step into the new year, Marlene,
Mhm.
what message of encouragement or
Mm,
appreciation would you like to share with infusion
mhm.
nurses?
Well, I knew you were going to ask me that question, and I gave that some thought and thought at first that this might sound somewhat cliche, but I really think that we need to think about this and take care of ourselves. So much of the time, we're taking care of patients, we're taking care of family members, friends, loved ones, and we don't take the time for ourselves. And so I think that's really important, whether that's just 5 minutes where you take a moment and you go into your office or can step away if you're in home, infusion and sit in your car. I've done that, sit in my car for 5 minutes and just take some deep breaths and just do some being present moments to spending time with family and friends to whatever helps fill your soul. I just think it's super important that we do that. And what I also found is that it's important to have an accountability partner. And because I say this, and sometimes I fall short of doing that, and I have to remind myself or ask some of my teammates to remind me to take care of myself as well. So, it's just super important for us to do that because we really, need to do that in order to provide the care that we are doing day in and day out for others. So I wish everyone the best in the new year and hope that you will take care of yourself.
Well, thank you for that. And any final thoughts before we wrap up today's episode?
Just want to thank everyone for tuning in and listening to the podcast, hoping that you'll also go into the Learning Center and find some of those other podcasts that you've maybe missed and some of those webinars that might be of interest to you. And look forward to 2026 and all that we have to grow and learn with INS.
Thank you. And from INS to you, we hope that you have a very happy new year and that we welcome you back into the studio starting January 26th, 2026 to listen to the very first episode of season 2 of the INS Infusion Room. As always, I'm your host, Derek, and it has been a pleasure sharing this very important discussion with you. Knowledge empowers us to make informed decisions. Until next time, stay informed, stay curious, and keep gaining knowledge.
Infusion complete.